Welcome to Bestmed Medical Scheme presentation on updates for 2022. This video highlights and summarizes the various options available on Bestmed with reference to the changes in benefits and contributions for 2022. NMG is an authorized financial services provider and is here to help you with your medical scheme membership. Our consultants are fully accredited with the FSCA, the Council for Medical Schemes, and your medical scheme. As one of the largest financial services intermediaries in South Africa, with more than 25 years of experience, we can assist with various elements of your medical scheme and provide you with sound, independent advice. Let's take a look at the benefit updates for next year. Bestmed announced a 3.9% average increase across their plans for 2022. An overview of the benefit changes includes the following. Benefit limits and sublimits increased by 4.2% across all benefit options. An increase in palliative and home-based limit subject to authorization and utilization via designated service providers across all options. A reduction in co-payments for non-formulary medicines, update to the chronic illness benefit medicine formulary. Members will only pay for the first 3 child dependents, previously 4. All additional children are free. Child dependents will be covered until the age of 24 years, previously 21 years, and registered students up to the age of 26. 1 lactation consultation with a registered nurse or lactation specialist across all plans. We will now be unpacking these benefits in a bit more detail. Co-payments for all non-formulary medicines have been reduced by 10% across all options. Benefit limits will be increased by 4.2%. 1 lactation consultation with a registered nurse or lactation specialist across all plans. Baby growth and development assessments have been added across all options, limited to 3 per year for children who are 0 to 2 years old. Antenatal supplements listed on the formulary can be claimed up to the benefit limit of 120 Rand per month for a maximum period of 9 months. From the 1st of January 2022, certain formulary changes and chronic drug amount updates will be applied. Affected members will have until the end of 2021 to make changes to their treatment program to avoid or reduce co-payments. Let's highlight several enhancements introduced by Bestmed. Introduction of the breast reduction surgery. Bestmed has added a medically necessary breast reduction benefit to PACE 4, subject to funding protocols, pre-authorization and benefit limits. The scheme will cover the procedure up to 100% of the scheme rate, up to a maximum of 50,000 Rand per family per annum. Mental health program enhancement. Major depression across all plans covered up to a specified limit. Once the chronic limit is exceeded, in instances where the depression is covered as a non-CDL chronic condition, the scheme will continue to pay for the treatment from risk. Diabetes program enhancement. The scheme has added the continuous flash glucose monitoring benefit for diabetics on PACE 3 and PACE 4. Preventative screening enhancement. Bestmed has introduced mammogram screenings for members on the Beat 1 option. Now that we've gone through the changes for next year, let's move on to an overview of the 3 components of your medical scheme: hospital cover, chronic cover, and day-to-day cover. Hospital cover is the most important element of your medical scheme. Hospitalization is unlimited on all Bestmed options. The actual rate at which you're covered for treatment in hospital will vary once again by your plan choice. This rate is reflected as a percentage of the scheme rate, and all Bestmed options cover members up to 100% of the Bestmed rate. Planned hospital procedures need to be pre-authorized with Bestmed by contacting the number on your membership card. Your doctor may do this on your behalf or may give you the necessary codes and descriptions to obtain the authorization yourself. Members on certain plans may need to make use of a network hospital in the case of planned procedures. In the case of an emergency event, members must go straight to the closest hospital. It is recommended that members always carry their membership cards with them. It is becoming more important each year to consider taking out gap cover. Gap cover is a short-term insurance product which can be purchased separately from your medical scheme and is an effective way to ensure that you're covered for hospital shortfalls. These shortfalls arise because there's no forced regulation on provider charges. Medical schemes may only cover up to a certain rand value, and/or your medical scheme has co-payments and deductibles. Gap cover will assist in covering the resultant in hospital shortfalls. Let's move on to your chronic cover. All plans cover for medication relating to 27 chronic conditions which are paid from risk. Certain plans have an additional list of chronic conditions that will be covered, so it is important to understand this before you consider a plan change. By way of example, higher costing plans include cover for certain mental illnesses such as depression. A plan downgrade will result in the member having to pay for this medication from day-to-day benefits instead of the chronic benefit. Should your doctor diagnose you with one of these chronic conditions, they will need to complete a chronic application form and submit this to your medical scheme. This will ensure that your treatment and medication relating to the condition is covered by the scheme and will not affect your day-to-day benefits. Each plan has a chronic medication list known as a formulary list to guide members on which medications are available on their plan. If you choose a medication that is not on the formulary, a co-payment will apply. Chat to your doctor about the possibility of changing to a formulary medicine to avoid this shortfall. Let's discuss the day-to-day benefits. Bestmed offers a variety of options to meet members' different needs. The majority of Bestmed options are known as hybrid options, which offer members cover for day-to-day in the form of a savings account and additional day-to-day benefits up to certain limits. There are pure savings options which cover for all day-to-day expenses from an allocated savings account. Hospital plans which do not provide any day-to-day cover, and capitation plans which provide cover via network providers up to certain limits, and the contribution is based on income. Bestmed offers comprehensive benefits for maternity and children up to the age of 2. These include 2D ultrasound scans and prenatal screening, antenatal supplements, antenatal consultations, a nutrition assessment, and a 6-week consultation. These are just some of the several benefits available to members. Now that you have a better understanding of the key components of your medical scheme, let's take a closer look at the options that are available. Here we provide a high-level summary of the PACE and BEAT series with reference to the type of day-to-day cover, chronic cover, as well as the principal member contributions. The BEAT series separates the contributions between non-network and network options. It is important to speak to a consultant to understand if the hospital networks would be suitable for you and your family before making any decisions. The Pulse series is a cost-effective, network and income-based option. The Pulse option has rich benefits including unlimited GP consultation, basic dentistry, basic optometry, a specialist benefit, maternity and casualty benefits, prescribed medication, as well as a limited over-the-counter medication benefit. Provided members stay within the network, these plans can be very attractive in terms of benefits and costs. Medical schemes often negotiate reduced rates with certain hospitals, allowing them to charge members less. These networks may be suitable for certain members depending on their location. It is important to note that members can use any hospital in the case of an emergency. However, if it is not an emergency, then a co-payment will apply. Let's take a look at an overview of the contributions. Below we provide a summary of the PACE and BEAT series contributions for principal member, spouse and children. The Pulse series is also summarized by principal member, spouse, and children, however, is further separated by income, providing the contribution per income category. Bestmed offer a comprehensive wellness program which we will now review. The Bestmed Tempo Wellness Program offers a variety of benefits. One health assessment, that is, biometric screening at a network pharmacy clinic, on-site at an employer, or by a qualified Tempo biokineticists for beneficiaries 16 years and older. One fitness test and 2 follow-up virtual consultations at Tempo biokineticists for beneficiaries 16 years and older. Nutritional assessment and personalized diet development, and 2 follow-up consultations with a Tempo dietitian for beneficiaries 16 years and older. Virtual health-related workshops with a focus on holistic wellness and related topics. Virtual group fitness classes with a wide range of group classes throughout the year to encourage and support a healthier lifestyle. Members must complete your health risk assessment and unlock Bestmed Tempo Wellness. Once unlocked, assessments are paid from your preventative care benefits. Where to from here? Should you like to make a change to your option, you can either contact your NMG consultant or use the NMG portal. The NMG portal is an online platform used by most of our corporate clients, which allows members to view their personal information, make changes to their options, compare rates and benefits, to name just a few features. This is all done with the highest level of security to ensure your information is kept safe. Should you like to speak to a consultant for more information, please contact us at one of our branches. Kindly note our complaints procedure should you not have been fully satisfied with any information in this presentation. Thank you for your time and take care.